So give the command.
Yes. So you are a specialist trainee at the district headquarter hospital. You are supposed to talk with the foundation trainee regarding the quality improvement project.
So I did not hear. Can you repeat again? The network gone suddenly.
Yes, you are working as a ST at district headquarter hospital.
Okay.
So you are supposed to discuss with a medical with the foundation trainee regarding the quality improvement project.
Okay. The name of the trainee.
Hemant,
Okay.
is it?
So shall I start?
Sure.
Okay. Hello Ahmad. I'm Dr. Sandeep, one of the registrars here.
Yes. Hi. Good
Hello. How are
afternoon.
you doing today? How is your rotation with our department?
Yes, I am fine. I am enjoying, but I have a bit. I have been assigned
Mm-hmm.
regarding perform the quality improvement project.
Okay, that's very good.
Yes. So would
Okay.
you assist? Can you guide me?
Yes, yes, sure. We can discuss. Actually, this is very important topic. Uh, if you wish, you can invite some of your colleagues because the discussion will be better.
Right, but now everyone is busy, so
Okay,
we
okay,
yes
not an issue.
no.
So to understand this quality improvement project, I would like to ask you some basic things like what do you understand by this quality?
Quality is something. It is the process which is in the larger interest of the patient's care, the health
Yes,
system, which again comprises of this in terms of the safety, and it may be in terms of the
yes, yes,
engagement and
yes,
also
yes,
the
yeah,
cleanliness. So these three, four, these are the components of the quality.
yes, yeah, yes. You are partially right. In simple words, like we can say, quality is like providing a care which will ensure the likelihood of the desired outcome, and
Mhm.
it will the care will be consistent with the current medical knowledge. Okay.
Mhm.
So
Okay.
when we discuss quality, like it should be based on certain principles. Like,
Mhm.
do you have any idea about that?
So I have a little bit idea, but
Mm-hmm.
I'm more interested in this
Mm-hmm.
the quality that discuss it. But this I don't know how to carry
Okay.
on with
Okay.
project.
Okay.
So
Okay. Actually, this quality, the quality improvement project, like for that we need to understand quality. What is quality improvement? Like this quality improvement means like
mhm.
improving the patient care and their experiences through like changing the behavior or certain modifications in the system and behavior of the patient care providers, also employing certain strategies and methods. uh, that's why like we need to have some plan for that. This quality improvement project, like I can explain you with some example.
Mhm.
Suppose, have you been assigned any particular thing to look for this quality improvement project?
Wondering for that, which topic you would
Okay,
suggest?
okay. So,
I
like,
was
to understand this in better way, like this quality improvement project that is implemented through phases. Like there is some cycle called as PDSA cycle. Like plan. If you follow me in this drawing, like it's plan, do, study, and act cycle. Like
mhm.
here, like before taking any project, like we have to define like what are we going to change. Here we will take an example like we will change the discharge policy, like the change the discharge policy in such a way that the duration of the discharge time will be shortened and the patient will be more comfortable getting discharged. Okay, we'll take this example. Okay, so
True.
we have to first define what we are going to improve in the quality. Secondly, like how we will do it, like then we have to plan how we will do. We have to identify who will do this, what we will do, what we will do to reduce the discharge time, what are our resources, like the plan where we will do it, what we will do it, and who will do it. Then once like for the discharge summary, discharge project, we can say like we can make a discharge form, and we can give to our the colleagues, and the discharge form will contain some summary or patient information notes and some guidelines to discharge the patient. This is our plan. Are you following me up till this now?
Yes.
Okay,
Apart,
yes.
yes. So
Yes,
apart from this summary, what other projects we can incorporate?
like we can see, we can do the quality improvement project in various things, like we can reduce the we can think of the project of reducing the rate of hospital infection. We can reduce the think of reducing the waiting time of the patient in the waiting area. Like such projects we can take and these projects, like these are bigger changes that we have to go through the smaller cycles. We can, so we
Mm-hmm.
cannot suddenly go and do the big change. We have to
Mm-hmm.
initially run the pilot project, and these pilot projects are run through a small cycle that is called a plan, do, study, act cycle. So like advantage of can you think that running initially the smaller cycles, what could be the advantage of doing through smaller cycles initially?
Yes, smaller. I think if we can do at smaller scale,
Mm-hmm.
then we can repeatedly and we can point out our this mistake.
Correct. Yes, like the bigger changes initially, if we do directly the big changes, then there will be lots of resources will be involved. Then the changes may not be accepted with the acceptable by many of the people,
Mm-hmm.
and like it will help us to move our idea to the action. Like we have idea of this, then we if you do small cycle, and if it's successful, we can put it to the action. Am I right?
Okay. And
Okay. So
another, one component is also the
yeah,
study
like
how
after
we.
after we do the plan, after we plan the things, then we implement the plan. That's like we have to put it in the action. This like the discharge product we have, which I have told you. Then we will on one particular day we will implement this form and discharge the patients and take their feedbacks. And we will take the feedback of the people who are doing this discharge, like nurses or our colleagues, and we can collect the data. After we collect this data, we will analyze the data. That is the study component. So,
Hmm.
what will you think we will do in the study after collecting the data? What we will do? What do you think?
Yes, we will compare with this pre-existing and with this change, whether this change is there any improvement. So we will
Yes, correct.
compare.
Yes, you are absolutely right. After collecting the data, we will analyze this data and we'll see whether this form which you have circulated in the discharge, whether it has it has shown the desired effect, or what we have planned initially, that we will discharge time by 30 minutes, whether it is really doing that. And we can analyze the feedback, how the patients are feeling, whether our colleagues are feeling, whether this is helping or no. So this analysis will help us to understand whether our initial thought process was correct or no. So after the study, if we find that this plan, which we have initially discussed, what change we need to implement, if we, if it is positive, we can act, or we can put it to the little bit wider side, wider level. Like if initially we will do on one day, then we can do to the 3 days, 4 days, and we can study further whether this plan is feasible or no. And if we found that this is working in a wider scale, then we can implement the change. Are you following me?
Can you repeat me again?
Yeah,
This.
like if this study shows that the positive outcomes, desired outcome, that this form is helping to reduce the waiting time, this
Hmm.
form is helping to convey information in a better way. If the patients are happy, if the colleagues are happy, we can implement this discharge from to the wider level. Like initially we were doing for one day, then we can implement for the whole week. And if it is working, we can implement to the other wards also, or in the wider level, like we can implement this project in the other hospital. Like we have to, if the plan is successful, we can go to the multiple levels. Like this, it will help. This PDSA cycle, like it gives us the idea the whether this plan is working or not. Is this okay with you? Are you following me?
Yes, you mean to say first we have to plan or identify a accomplished goal, and then we have to do it, and then we have to action, and then we have to study it.
Yes, correct. Yes, you are very good learner. And uh, like, do you have any other concern at this moment?
No, can you? Yes, I have. Where we can, which resources and who can help us for accomplishing this whole project?
See, like the resources depends on the what we are actually going to do. Like if we are going to implement the plan in the ward, then we can take help of our colleagues, or we can take help in the of the nurses. We can take help of the seniors. It depends on the plan what you are going to implement the change. If we are going to implement the change like reducing the waiting time in the reception, then there we can take help of the reception area nurses, like that.
Okay, doctor, is there any? There is a one query regarding. Is there is one and same thing regarding audit? Is there any difference between this audit and this quality?
Yes, this is very good question. Actually, in audit, what we do, we compare our current practices with the standard practices. Like if we have infection rate of 3% and the standard says like infection rate is 1%, then that comparison called as audit. And
Okay.
like quality improvement is like changing what is the current practice we have. The thing is already there in the this like quality improvement, like reducing the infection rate from 3% to the 1%. Like it is changing the current practice.
So you mean to say it is more or less same?
Is like there is a lot of overlap between quality improvement and audit.
Mm-hmm.
Okay.
Okay.
So can you repeat the things which we have just discussed?
Yes, today we have discussed. You explained regarding the what is the quality and how to carry on the quality improvement project, and also the pillars of the that project that contains this plan, do, act, and study, and but all these four pillars. So how they can be implemented.
Yes, yes, okay. And let's study this more in detail, and we can discuss this project again. And you can always come to me if you have further questions. And I would like to thank you for refreshing my knowledge. Thank you, Ahmad.
Okay, thank you also for your time.
You are
Thank you.
most welcome.
Thank you.
Nobody kept the timer.
I think 8 minutes, more than 8 minutes.
Okay. So your
सब भूल गए यार, टाइम का बताना तो था.
it's
It
okay.
went out of totally.
Not an issue. Chalo. Difficult topic actually.
Difficult topic. Yes. It's difficult.
Yes, Dr. Jay Prakash, tell me.
Okay, can anyone tell me what is the difference between audit and quality improvement?
Like audit is comparing the current practices with the standard practices, and quality improvement is implementing a change. This may not be standard practice. It is not may not be a guideline.
Okay, I got it.
Audit
But
is like comparing with the guideline, or comparing with the nice guideline is saying like this. Then audit what we are doing or no. Then we will compare with the nice guideline, and then we will change ourselves. Quality improvement.
In quality improvement, mane service.
It
We are
can be
giving the
anything,
service to
like
the people.
any service. It may not be like comparing with the guidelines and doing the changes.
Yes, you are very good.
Sandeep, I got phone in between. Like you said about the other six component like
Actually,
effectiveness, safe, and
yes. Actually, what happened?
you know,
I was
reproducible,
about
and
to tell. Then Dr.
hmm,
Jayaprakash said, I don't want to, like, I want quality improvement, not the quality. So I have to divert to directly the PDSA cycle. He did not allow me to go to the components of quality.
hmm, hmm, hmm.
Tell us what are the components of quality?
Like this, whenever the quality is quality to be ensured, these six component we should consider. Like it should be, remember it is by SPIT, SPEET, SPIT. It should be safe.
Acha.
It should be safe. It should be patient centered. Then it should be
Hmm.
effective. It should be efficient. It should be equitable, and it should be time bound.
SPEET.
Triple
Speed.
ET.
Okay.
SP triple
Triple
ET.
ET. Okay.
Triple is efficient, equitable, and effective.
Okay, and
Like
time bound. It should be time
and
bound.
is
Yeah.
time bound or timely. Safe means like avoiding harm, avoiding medical errors, providing safe environment to the patients as well as the medical carers. And patient centered means like we have to understand the patient concern, provide the care according to the patient needs.
Waiting time. You said waiting time in the OPD.
And we should be more compassionate, and patient should be treated with the respect and dignity. Then efficient means you should not waste more resources. It should be within the resources whatever we have. It should be best care within the whatever available resources. If effective means like it should be commensurate with the current medical knowledge, and it should be based on the guidelines or best available evidence. Then equitable means that
Who are the persons who will do this quality? Who are the personnel who will do this
quality
quality
improvement can be
improvement?
done by any person. It could be the head of the organization. It could be a independent body. And as a registrar also in the ward, we can implement this cycle, small cycles. Then we can escalate the change.
And it will be
There is no
published? No.
particular like research body or anything. But the change should
It will
like
not be published.
the problem should like there are certain things also to identify the problem. Like it should be the change which are we are going to implement, that there should be an answer to that particular change. Like if we are deciding about infection to reduce, whether we are able to do that infection or no, and it should address to a particular problem. It should not be and it should be within the safety limits. It should not violate you can say the patient safety and all things. That's the first component is safety.
Okay. Now
So
it is very
usually
clear.
scenario start with this quality and then quality improvement and then PDSA like this usually.
Yes.
Yeah.
And also in this, Dr. Sandeep, also we should also involve while carrying out this quality improvement project, we should also involve these stakeholders are also the consumers feedback, whatever change we made.
Right.
And what are the component of there is a clinical governance? Also, I think 6 components.
वो next time करते हैं यार. Clinical governance बहुत difficult है. Next time you are the candidate, I will be role player. Okay. So any feedback about the communication? It was very fast. I think I'm doing it after a long time.
I feel somehow, I mean, it was good, and the only thing I noticed, like, it was overlapping with the audit.
See, there is actually a lot of overlapping with the audit and quality improvement. The quality improvement is a bigger umbrella.
Bigger umbrella, yeah.
Like
definition of improvement, quality improvement was, I think, I did not start with the definition. Otherwise, like flow and the consistency was very nice.
Chalo. Let's wind up and we can meet next week. Okay?
Yeah.
So I will upload all these 3 videos in Next 3-4 days, anybody wants to listen.
Being